Hello, everyone. Welcome to the Less Insurance Dependence Podcast, the official podcast of the Reducing Insurance Dependence Academy. If you're not a member, go to rid.academy, Reducing Insurance Dependence Academy, rid.academy to sign up. The membership is on us. This community is growing like gangbusters. There is a groundswell movement with literally 1,300 plus dentists all saying, I've had it enough with PPO plans and I want to reduce my dependence on PPO plans or possibly even become a fee-for-service practice. So rid.academy, check that out. Before I jump into today's topic, I have a quick announcement to make. Today's topic is, what does it really mean to be fee-for-service? And as many of you know, Gary is an expert in helping practices drop PPO plans and even going all the way to be a full fee-for-service practice. So if you are serious about this, we would like to gift something to you. We would like to go to thrivingdentist.com/CSM coaching strategy meeting. Have a chat with Gary. We don't typically do this, so it's a limited time offer. So go to that link, thrivingdentist.com/CSM. See if going all the way fee-for-service or dropping PPO plans is right for you. Any comments, Gary?
Yeah, Naren, thank you for mentioning the coaching strategy meeting. We are accepting new clients. We don't always accept new clients because of the intensity of our support. It requires a lot of intensity to support our clients, and we don't always accept new clients, but we are available now. So if you'd like to know whether you have the right situation to reduce insurance dependence, schedule that coaching strategy meeting. The purpose of that meeting is for me to learn about your practice. You can help make some decisions about that. And then also, if you'll allow, I'll share a little bit about our coaching to see if it's a good fit. The truth is, Naren, not every dental office can successfully reduce insurance dependence. Right. Not every office can do that. There are offices that when I have that coaching strategy meeting, I will say, as much as I would like you to get there, there's a lot of things you need to do before you start resigning from PPO plans, and you're not ready for it. I don't like delivering that message, Naren. I'd much rather say, no, you can do this. We just have we have to follow the steps, and we have to make sure we dot the I and cross the T, but you can do this. But right. Occasionally, I have to say, no, I wouldn't do this. I wouldn't recommend this. Your practice isn't strong enough to be able to start reducing insurance dependence. While I don't like delivering that message, it can save a lot of pain and aggravation from finding out the hard way that you weren't ready. It's not that you could never do it, but maybe not right now. Right. So if you're curious about that, schedule a coaching strategy meeting and we can sort that out. That opens up a link to my calendar. You pick a time that works for you, and you and I get to talk on Zoom. Look forward to that.
Thank you, Gary. I just wanted to, before I jump into today's topic, share my perspective on this. So the topic today is, what does it really mean to be fee-for-service? And there's a lot of misinformation out there. If you go to Facebook groups, if you go to different communities, a lot of people think of fee-for-service as, I don't like those people on PPO plans. I don't want to have anything to do with them, right? But to me, that's a very narrow definition. And of course, I learned that it's a narrow definition since I started working with Gary, because Gary has some actual experience helping practices go all the way towards fee-for-service. But he doesn't want to discard anyone. He doesn't believe in ignoring half the population who are on PPO plans. So Gary, let's have this wonderful conversation about, what does it really mean? There's a lot of misunderstanding. There's a lot of wrong ideas people have.
A lot of confusion.
Yeah, exactly.
This surfaced recently in a Facebook group of dental professionals, and it was a very engaging thread on a particular Facebook group. And Naren, what was interesting about it is if you read 50 comments, there were 50 different definitions of what it means to be fee-for-service. It was completely polar opposites. So it reminded me that we can't assume that everybody knows what it means to be fee-for-service. So let me give you the definition. What it means to be fee-for-service is that you charge your fees, whatever your fees are, your UCR, your usual, customary, and reasonable fees, whatever that is, you charge those and you receive that from your patient. That's what it means, that you receive that for compensation for the dentistry you did. your usual fees. That's what fee for service means. Now, the devil is in the details. There's a lot of different details that are important to pay attention here. Let's dive into some of the details. And I'm simply going to disclose right now that my approach has always been to be patient-friendly with this, to be patient-friendly. Personally, I think any decision we make in the practice needs to be run through the lens of how would it feel if I was a patient? How would it feel? How would that work if I was a patient? And run it through that lens. And I think that's a really good filter to run it through, because you're always making decisions that are patient-centric, that are in your patient's best interests. And I think one of the things that's absolutely in your patient's best interest for you to be fee for service is that it allows you to deliver the highest quality dental care, and it allows you and your team to work hard so that every visit is a positive experience. And both of those are patient-centric benefits. Patient receives the highest quality care using the latest technology, using the latest advances, using the materials that you would use if it was in your mouth. And hopefully, the goal is also to provide the kind of experience that you would want. Those are patient-centric byproducts or results. Does that make sense, Naren?
Yes.
And I think when you run it through the filter of what's in it for the patient, that allows you to make decisions that really is a rock solid foundation for your practice, because you're testing it. It's a litmus test of how would this feel if I was a patient. Now, my approach on being patient-friendly is that, let me give you the opposite of that. There are some consultants out there, I'll leave them nameless, Naren, but there are some consultants that said, when you resign from PPO plans, you should simply wash your hands of insurance and have nothing to do with it at all. Nothing to do with it at all. And they might go as far as to say, hand your patient a claim form and tell them, you pay us, and if you'd like to get any reimbursement from your dental insurance company, here's the claim form. Now you submit that on your own. Good luck. Naren, I couldn't disagree with that more.
I would totally concur. I mean, that doesn't make sense, right? Part of what the patient is looking for is a good experience. Like, now I have to like jump through hoops to come and see you. It just
now the
doesn't
reality
make
is,
sense.
Naren, you and I are I'm able to see you on a Zoom call. Of course, our listeners are listening to it in audio. But if that happened to you or I as a patient, the truth is you or I could probably figure out how to file a claim form, right? Well, I shouldn't speak for you, but I know I could. I think you could, right?
I'm sure if I really wanted to, I could. The question is, do I want to?
What would you do, by the way? What would the first thing you'd do if you had to file your own claim? You'd Google it.
Yeah, I would Google it probably, yeah.
You'd Google it. You say, how do I file an insurance claim form?
Yeah.
And then you know how to do it. But the public, let's talk about the public, John or Jane Q public, they don't know how to file a claim form. So I don't agree with that approach. I don't agree with that. And I want to do it as patient-friendly as possible. I want the patient to know they can choose our office for their care. They can use whatever benefits they have right here in our practice. We're going to still file the claim form for them like we always have. And we're going to be on their side to help them get every dollar of benefit that they have.
Mm-hmm.
So when patients hear that, imagine that you're currently in network and you're going out of network, but you're using the approach that we teach our clients to do. Naren, you can still come here. You can choose our office. Whatever benefits you have, you can use them right here. We'll file your claim form like we always have, and we'll be on your side to help you get every dollar of benefit. How does that land on you as a patient?
It shows that you care. It shows that you're
Frankly, it's not much
in your
different than
power.
it is now.
Yeah,
It's not much
exactly.
different than when we're in network.
Mm-hmm.
And guess what? The majority of patients choose to stay with you when you do it that way. Now, let me go through another detail. Because we submit the claim to insurance, some PPO plans, once you go out of network, will not pay your office. It's called the assignment of benefits. They will not allow you to accept assignment of benefits. And they will only send the check directly to the patient. Delta is notorious for that.